My name is Marina, and I will be your nurse, and I will be doing your physical assessment. Okay, so in general, my patient appears alert, cooperative, pleasant. His skin is evenly toned. His sclera are white, which tells me that he doesn't have jaundice. So I would like to take a look at your stomach. So if you can please lay down. Okay, so I'm inspecting his abdomen, and it's symmetric. It's protruding a little bit. The skin is within normal limits. There's no rashes and no scars. So now I'm going to be auscultating his bowel sounds in all 4 quadrants. Right upper quadrant. Left upper quadrant. Left lower quadrant. And right lower quadrant. So his bowel sounds are normal, active in all 4 quadrants. And now I'm going to be listening to his vascular sounds, the aorta, femoral arteries, iliac arteries, and there's no bruise noted on auscultation. Okay, so now I'm going to be percussing the abdomen. So the sounds are tympanic, generally tympanic across the abdomen. Okay, and now I'm going to be percussing the liver. So it's dull right here. Or right here. So his liver span is 10 centimeters, and that's within normal limits. And now I'm going to be percussing his spleen. And the sounds are tympanic, which is normal. It means that his spleen is not enlarged. And now I'm going to be palpating, like palpation. And please let me know if you feel anything. No? Okay, and now I'm going to be doing deep palpation. And there's no rebound tenderness. Okay, and now I'm going to be palpating the aorta. And there's no thrill present. And now I'm going to be palpating the border of the liver. Take a deep breath. Okay. So there's no masses or tenderness or enlargement of the liver. And now I'm going to be palpating the spleen. It's not palpable. So that means there's no spleen enlargement. And now I'm palpating his kidneys. And his kidneys are not palpable. Do you feel any pain? There's no tenderness. Okay, so can you please sit up? Okay, so now I'm going to be inspecting his clavicles, his shoulders, and his scapula. So these structures appear symmetrical. There's no swelling or inflammation, no redness. Okay, and now I'm going to palpate the sternoclavicular joint. Okay, the clavicles, the acromyoclavicular joint, the acromion process, and the spine of the scapula. Okay, so do you feel any pain? Okay, so there's no pain, no tenderness on palpation. Now I'm palpating the greater trochanter of the humerus. Do Do you feel any pain? Okay, no pain. So now I'm palpating the groove of the biceps and triceps. And there's no tenderness or muscle spasm on palpation. So now I'm going to check for the range of motion of your neck. So can you please move your head side to side? Okay, and then forward and then back. Good. So the neck is with full range of motion, and I'm testing for the strength. So can you go, good, and this, good. So the strength of the neck is 5 out of 5 against resistance. Now I'm going to be checking for the range of motion of your shoulders. So if you can please reach forward, good, and then reach upward, good, and then reach down, good. Okay, and now I'm going to ask for you to, I'm going to check his external rotation. So can you make your hands touch the back of your head? Okay, and then internal rotation, arms behind your back. Good. Now I'm going to be checking for the rotator cuff strength. So can you go like this? So I'm going to apply pressure internally, and this is going to check the external rotator strength. Good. And now externally, I'm going to be checking the internal rotator strength. And it's 5 out of 5 against resistance. Okay, so now I would like to check your bicep strength. So can you flex? Good. And now, triceps. Good. So it's 5 out of 5 against resistance. And now, I would like to check for your range of motion of the elbow. So can you extend and then flex? Okay, and then go like this. That's pronate and then supinate. Good. And now I would like to check the reflexes, the biceps. Good. Now the brachioradialis reflex. Good. Okay, and the triceps reflex. Okay, so they are 2+ reflexes, and now I'd like to check your pulses. So the radial pulse and the brachial pulse, radial pulse and brachial pulse. Okay, so his pulses are 2+ and there's no thrill. Now I'm looking at his hands, his wrists and hands and the skin, and his wrists and hands are symmetric bilaterally. There's no inflammation, no nodules, no swelling. Okay, so now I'm going to be palpating the wrists. Do you feel any pain? Okay, so I'm palpating the snuff box. Do you feel any pain? Okay, now I'm palpating the joints on his fingers. They feel smooth. Okay, good. Okay, so now I would like to check your range of motion of your wrists. So can you, okay, so go up, that's extension, down, flexion, good. Now I want to check the range of motion of your hands. So can you, well, first of all, second of all, wrists, okay, up, down, in, so that's adduction, abduction, good. Okay, so now your hands, so can you please do the hitchhike? Okay, now touch your hand, your thumb to your index finger, and then pinky, and then flex, and then extend. So he has full range of motion of his hands. Okay, so now can you please lay down? Okay, and I'm going to be checking, I'm palpating his hips. Do you feel any pain? Okay, so now I'm going to be checking for the range of motion. So do not bend your knee. Can you raise your, good. So that's 90 degrees, and that one, good, that's also 90 degrees. And now you can bend your knee and then bring it up, good. And second one, good. So that's like 180 degrees. So that's within normal limits. And now I want to go like this, and I want to externally, range of motion of your hip. Good. Internally. Good. Okay. Externally. Okay. And internally. Okay, good. So now I would like for you to sit up. And I'm going to be inspecting your lower extremities. So the lower extremities appear symmetrical. There's no swelling, no ecchymosis, no edema. So now I would like to palpate them, the knees. Do you feel any pain? Okay, the ankle. Okay, the Achilles. Okay, and the feet. No pain. Okay, good. So now sit. Okay, so now I would like for you to extend your knee and then flex. Okay, and now do it. I'm gonna do it against resistance. I'm checking for strength. Okay, good. And then yes. Okay, good. So it's 5 out of 5 against resistance. And now I would like to check the range of motion of your wrist. So I want you to do this. This is dorsiflexion, and then straighten your foot, and that is plantar flexion. Very good. Okay, so now I would like for I'm gonna check your ankle again. So so it's moving side to side, inversion, and invert and evert. Okay. Okay, and now the foot, inversion, side to side test. Okay, good. Okay, and now I would like to palpate the pulses. That's the popliteal. That's the posterior tibial and the dorsalis pedis. Popliteal, posterior tibial, and dorsalis pedis, and they are 2+ and no thrill. Okay, now I'm going to check the patellar reflex. Okay, good. And then the Achilles reflex. Oh, good. And then the plantar reflex. Okay. Good. So his reflexes are 2+. Now can you stand up? Okay, so I'm looking at his spine. So his spine is, landmarks are symmetric. His skin is within normal limits. The curvature, the spinal column curvature appears normal. And I'm going to be palpating. And palpating the spine. Okay, so there's no vertebral tenderness. Do you feel any pain? No paraspinal tenderness. And no masses. Okay, now can you sit down, please? Okay, now I'm going to be checking neurological status. So could you please go like this, rapid alternating movements. I'm going to do this and do this fast now. Good, so he's able to do that rhythmically and smoothly. Now can you put your heel to the knee, the opposite knee, and go down. And same. Good. So he's able to do that smoothly. Now I'm going to be checking for the exteroception. Exteroceptive sensation. Okay, so close your eyes. So first, I'm gonna be touching you with something soft, something dull. You can something dull and something sharp. So tell me what you feel. Well, I'm gonna let you feel what soft feels like.
Okay.
This is sharp,
Okay.
right? And this is dull. Okay, so
Soft. 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 Soft.
okay,
Dull. Sharp. Sharp. Dull.
good. Now I'm going to be checking for temperature sensation, and can you tell me what you feel, if it's warm or cold?
Cold. Warm. 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 Cold. Warm. Warm. Cold.
Mm-hmm.
Cold.
Okay, good. Now I'm going to be checking for proprioception. So close your eyes, and I'm going to be, tell me, I'm going to be moving your finger, and if you tell me if it's up or down.
Up. Down.
Okay.
Down.
Good.
Up.
Okay, toes.
Down.
Mm-hmm. Okay,
Up.
good. Okay, now I'm checking for the vibratory sense in his feet. Do you feel this?
Yes. Vibrating.
Okay, and now the second foot.
Yes, it's vibrating.
Okay, good. Now I'm going to be checking for stereognosis. I'm going to put something in your hand. And you can and let's see if you can identify what I put in your hand. Close your eyes, yes.
Key.
Okay,
A coin.
good.
A coin. A key.
Good. So it's intact. And now I'm going to be checking for graphesthesia. Okay, so I'm going to write something on the palm of your hand.
3.
Mm-hmm.
Number 8.
Yes. Okay, and now checking for 2-point discrimination.
2 points.
Yes, so tell me when you feel 2 points or 1 point.
2. 2. 1.
Okay, that's good. And now I would like to check for extinction. So close your eyes. I'm going to touch you somewhere and tell me where I'm touching you.
Okay. My wrist.
Okay, I'm touching you 1 point.
Both wrists.
Okay, now I'm going to touch you and let me know if it's 1 or 2.
Only left.
Okay, good. So now, can you stand up for me? And can you please walk? Okay, good. And now can you walk on your heels? And tiptoes? Good. And heel to toe. Okay, good. So his gait is smooth. There's no loss of balance, no loss of coordination. So now I'm going to be checking for the Romberg sign. So can you please stand feet together? Okay, and now close your eyes. So he's able to maintain his balance and there's no swaying. And now I'm going to be checking for the pronator drift. So can you go like that? Okay, good. And there's no drifting of his arms downward. That's it. Okay, and that's the end of our my examination. Thank you.